Hi, everyone. Welcome to Connection and Caregiving Part 4 Q&A with Dr. Sheetal Ajmani and myself, Wendy Goldberg. We just welcome you to this last part of our series. We wanted to take this time to reflect on the past 3 sections and give you guys a chance to come on and ask us some questions. We're definitely going to have a little conversation on our own. But, again, if anyone is new, my name is Wendy Goldberg, and I'm president and founder of the Benjamin Goldberg Foundation, where our mission is to empower and support children, caregivers, and communities through education, integrated programming, and advocacy of the healing arts. And also, this is Dr. Sheetal Ajmani joining me tonight, the medical advisor of the foundation.
Hi, Wendy. I'm so excited to do this.
I know talking to you is always so fun, but it's extra special when we're doing this as part of our programming.
Yeah, absolutely. And we've had such a great series these past 3 weeks. So, for those of you who may be new to this, or maybe you've been around for the past 3 weeks as well, but may not know kind of where this series came from. So, a big part of our mission at the Benjamin Goldberg Foundation, we focus on work around children, caregivers, and the community. And so we've noticed a lot of interest and sort of this gap in resources available specifically for caregivers. And so we've had it on our minds for a bit to put together some sort of resource. Now, we do have some resources on our Peace Out portal already, specifically for caregivers, as well as individuals who are on the healing journey themselves. But we wanted to put together something very specifically to address the unique needs and the unique experiences of caregivers. And that's where this 4-part series was born from.
I know. And, when we started the foundation back in 2018, we were really focused on the patient. But a lot of the feedback we have gotten over the years is the caregivers need just as much support. And so that's why programs like these and things that we have planned for the future are so important to our community.
Yeah, absolutely. So the very first session was with Cindy Griffiths, and I was traveling that week. I was out of town, so I wasn't able to join in live, but I did watch the replay, and what a beautiful session that was about empathy in the caregiving experience.
Yeah. I mean, she speaks on this topic globally. And, I can say she's an expert, on empathy. I had her on my podcast a few months ago, and we talked about being empathy. I always mess it up versus being empathic.
Empathic.
So can you dive in, Sheetal, to a little bit about those differences?
Yeah. So, Cindy did a really great job of explaining empathy when you're like, kind of develop an understanding, a caring for someone else's experience. Whereas empathic is where you're actually feeling what they're feeling. Like you're actually taking on the feelings, the energy of what someone else is experiencing. Cindy actually gave a few anecdotes in her own experience where she physically felt what her loved one was experiencing. And so that is being empathic. And she did a really great job in that first session of really something that I thought was really helpful was that she really gave lots of examples to, if you're not really sure if you are empathic, a lot of different examples of ways that you can kind of detect when that is going on with yourself as well. And why it's important. And a big part of why it's important is because if you're like taking on the energies, the feelings, the emotions, even perhaps in some cases, as she described, sort of the physical symptoms of your loved ones, of those who you are giving care to and for, then what's going to happen to you as the caregiver? You're going to end up feeling depleted, drained, overwhelmed, all of those things. And then that affects how you're able to best show up. So that's why it's such an important topic and distinction to just be aware of.
I know, because if you aren't, then you almost feel like you're ill or would need care yourself. And so I thought she gave some really good tools on how to decipher what is your own discomfort and what you could be carrying of someone else's.
And then she also gave a lot of really helpful tools. Once you recognize that, things that you can do to care for yourself in those situations as well, to sort of preserve your energy as well so that you can show up whole and as your best self and as whole as you can given those circumstances. And some of those, you know, tools that she described, one was kind of like she gave an example of, if you're sitting in a doctor's office and if you notice that you kind of pick up the energy, like in the waiting room, and you pick up the energy of everyone around you. I believe she's mentioned that she had a client or someone she knew who she was working with who would always come in and wear a hoodie because they just felt that it was almost like this veil of protection. And Wendy, I was sharing with you earlier today that when I was practicing pediatrics, when I was practicing as a pediatrician, seeing patients day in and day out. And this was even before the pandemic. I would come home and it was just my routine, my ritual. Every time that I would come home from a shift, the first thing I would do is I would take a shower. And that was really because I am the type of person who really does take on sort of those energies, those emotions of a lot of things going on around me. And so I've had to do a lot even before this series, even before all of this. I've done a lot of work myself around this topic. And so I would take a shower because I felt like I was just washing off and washing away all of those sort of energies, emotions, because I was seeing obviously very emotionally demanding, mentally demanding, physically demanding situations practicing as a pediatrician and seeing patients day in and day out. And so just having that time, not only that time to just connect with myself, but also that time to just in a way, like figuratively, metaphorically, and literally just kind of washing things away.
I love that. And then, I worked with a shaman healer for a bit, and she taught me something. I actually have it in my note section of my phone, but almost like a protection because I was in and out of medical facilities. And, there's a lot going on when people are ill, and you could be in a hospital with hundreds or thousands of people. And so I would just very quietly before I would enter a building saying, whatever spiritual thing that resonates with you, but I would say the violent flame of Saint Germain, protect me and surround me as I, whatever that is, like go into this building for this appointment and come back out. So there are things you can do. And it
I
really
love
just gives
that.
you a little agency too.
Yeah, it
And I
does.
have to say,
Yeah.
it did make a difference because sometimes I forget. I can tell.
That's something like with a lot of the things that we're going to talk about today and that were talked about over the past 3 weeks. A lot of those examples, some of those tools, some of these practices I myself have been doing in my own life for many years. Like I mentioned, I've been working on my own different tools and practices. I just gave one example with sort of that empathic responses. But also, Monica Rao came in for last week's session and guided through a meditation, a body scan, awareness on the breath. Those sort of practices I've been doing for close to 2 decades, well, more than 2 decades now. And, with a lot of these tools, I found, at least when I was first starting to use them, I noticed a bigger difference on the days that I wasn't doing it or that I wasn't using it, because then I knew like, wait, something feels off. And that's how I knew that those practices, those tools were really helping and really beneficial to me. I was just reminded of that when you shared that when you didn't see that prayer walking into a clinic, that's when you could tell like, oh, there was a difference here.
Yeah, and that's when I feel like, we'll talk about this a little later when we talk about meditation with the session with Monica, but like really it becomes really part of you in
Yeah.
that integration. But yeah, we can dive into that a little bit later.
Yeah, absolutely. Absolutely. So let's see. Then we had Dr. Kapil Kapoor on for the second week session. And welcome to everyone who is joining us live now. I know that a few more people have joined us since we started. So welcome. And as you know, this is a bit of a conversation that Wendy and I are going to reflect on all three of the previous sessions. And it's also a time for some Q&A. So as you're joining us, whether you're joining us live now or watching the replay, please leave your questions and comments for us as well. But yeah, our second session was with Dr. Kapil Kapoor. That was a really fascinating session. He shared a lot of really interesting themes and approaches to really empower, I feel like, patients and caregivers to be strong advocates for their health, particularly in this sort of rapidly changing healthcare system that we are working within. these days.
And if I remember correctly, Sheetal, he's Mayo Clinic trained in his training, and he is such an advocate for the patient and the caregiver relationship. And that conversation, I loved it. It was honest conversations, because it's so important when you're kind of thrown into these caregiving situations, and sometimes it's out of the blue. And a lot of times they're not acute situations where you're going to come in and deal with a situation and it passes. I mean, they're like in Dr. Kapoor's practice, he deals a lot with eyesight and people losing their eyesight. And, there's so many factors that play into that. For him to, take time to draw attention to this is very remarkable.
Yeah, absolutely. And something that came up in that conversation that Wendy, you and I were actually reflecting on since that conversation was we had discussed a bit about that experience between the patient and the caregiver. And now, just because we were just talking about Cindy's talk too, and we're moving into this, it's kind of giving me this different, an interesting lens of this. Because one of the things we had talked about is, you know, a lot of times as a caregiver, you might sort of put on your loved one what you think you would want in that situation, but that might not actually be what your loved one wants or what your loved one finds helpful. And so it's almost like I'm thinking about that sort of part of that we were talking about with that empathic conversation too, of like, what's yours, what's theirs, that sort of thing, right? So even in that caregiving experience, sometimes you might feel what your loved one is going through if you're empathic, but also in general, as a caregiver, you might put on your loved one what you think you would want in that experience, as opposed to truly just asking them, like, what will you find most useful? Or like, and this was some of the examples that we had given in that session of like, for your loved one, they might want to go into the exam room, the doctor's office by themselves, but they want you to be there waiting for them in the waiting room when they come out, right? So even just asking your loved one, like if you're the caregiver, asking your loved one, like, would you like me to come in with you, or would you prefer that I stay in the waiting room, to make it easy for them and to let them make that decision.
Because they carry some guilt that you've given up your time, that you're having to go to these appointments with them, and they don't want to be a burden. That's what even for children, they don't want, they don't have the vocabulary to say that, but they really don't. And yeah, so I love that we're talking about this right now.
He also, another thing sort of to that point that I jotted down too is, and that he spoke a lot about, and especially with his patients, as you had mentioned, he's an ophthalmologist. So he has a lot of patients who are having vision disturbances. They might, because of that, feel some loss of autonomy, right? Like they might not be able to drive for a period of time or things like that because of their eyesight. And so, really having that conversation with your loved one and giving them these sort of, what would you prefer? And kind of giving these options helps to maintain some sense of that autonomy and a sense of agency as well, which can feel when you're in a situation where you feel rather powerless with a new diagnosis. It restores the fact that no, you actually do still have power and agency and empowerment, right? And so I think all of that is really important as well.
Yeah, I remember when Ben was very small. He was 5 when he was diagnosed, but by the time, towards the end, there was a time we could have done around a chemo here locally at the Children's Hospital, or we could have gone to New York. We ended up doing both, part here, part there. However, I wanted him to feel a part of that conversation. I mean, it was a lot on him. And so we asked him, where would you rather have it done? When he was able to understand, all of those little things I think mean a lot, to that. And it also builds that relationship that you are in with the patient and the caregiver.
Yeah. You know what I'm thinking, Wendy? Something that you share often, you've shared quite often when you share your journey with Ben, of specifically as it relates to like the healing arts and the mission that we're on now, with his legacy is carrying on. of, that all of these things, they didn't change the outcome, but they did change the story. And I'm thinking about that as well with all of this, what we're talking about with the caregiving, right? Like sometimes, we may not be able to change the outcomes, but we can help change that story, that journey for ourselves and our loved ones in that caregiving experience.
Yeah, and when we talk about the healing arts and people, it's funny, a lot of times they'll ask Sheetal or I, like, the healing arts and how do you guys do it? And we kind of giggle a little bit because, we are so integrated in the healing arts as a team. Like all of us just kind of live the healing, like we're like walking healing arts. So, it's easy for us to share, but it is because of what I learned, through that experience that it wasn't even an option for me to do it. It was almost like a have you know, to keep myself in the best shape so I could show up in the best way, for the patient. So,
Yeah,
yeah,
absolutely. For me, in terms of as a professional caregiver, being as a physician and a healthcare provider, I leaned into mind body practices very early in my career. I mean, in fact, my very first semester of medical school, and those mind body practices helped me through just the rigorous demands, as I'd mentioned before, physically, mentally, and emotionally of caregiving in that professional capacity. Mind body practices for me being yoga, meditation, mindfulness, presence, spirituality, that sort of thing. But yeah, it really is, I think everyone, as you just mentioned, we do get that question a lot. And the fact is that everyone on our team we really are living it. And that's what we mean by that. We have had different experiences that have led us to lean into these tools and really see firsthand how powerful they are. Now, of course, my role as the medical advisor and as physician who practiced medicine for many years is to also look into the evidence behind these. And that's also what's wonderful is that more and more there is evidence coming to light that is backed by not only experience, but backed by scientific research studies, controlled studies that are demonstrating impact and positive impact of these modalities as well.
we were on a call today with a speaker from our upcoming Healing Arts and Medicine conference for next year, and he is in the sound space. I interviewed him on my podcast a few years back, and he is really a trailblazer. I think he was talking about there's over 100 studies just on sound, right?
Yeah, yeah, on sound therapy, singing bowls, and really excited. I'm so excited about all of our speakers for the upcoming conference, which is going to be January 2026. And the theme is on mind body medicine. And our speakers are all going to be sharing about the science, stories, and the impact of these practices. And exactly one of our speakers that we just had a conversation with earlier today, he was also providing sound therapy to patients at the Cleveland. He's now providing sound therapy to individuals at a mental health clinic. So really this integration of all of these modalities are just so vital. And it is starting to be seen also in some of these academic medical centers that are really actively and intentionally bringing these modalities to their patients within those settings.
And what I love and what I often say about, the work we're doing at the healing arts, it's not just one thing. It really is an array of things. Not everyone is going to be drawn to music when you're in treatment or on your medical journey, or not everyone is going to be drawn to art or but there's so many things. Everyone's going to find something that will help soothe that time.
Yeah. And I will do a quick shout out to one of our partners here. I mean, we have so many wonderful partners, but one partner specifically is coming to mind here in the Hampton Roads region when I'm specifically thinking about patients and caregivers is the Carrillo Kern Center of Integrative Therapies. And they offer a wide array of different modalities: massage, Reiki, art therapy, music therapy, Tai Chi, yoga, meditation. And those are all open to patients and their caregivers. So I just want to do a quick shout out to that. If there's, so if you live in the Hampton Roads region, definitely look up their website because it's something that you can do together, which is really lovely.
And also another one of our partners, the Children's Hospital, the King's Daughters, through the Benjamin Goldberg Playroom, has started doing yoga therapy for caregivers and the staff. So, that's really exciting that those therapies have expanded beyond patient care, and they see such value in doing.
Yeah, absolutely. So let's see. So that was we went into all of that stemmed off of us sort of recapping Dr. Kapil Kapoor's session, which was the second session in this series. The third session last week, we had Monica Rao on, who also we've partnered with a number of times over the years. I believe she's been a guest on your podcast on Sundays with Wendy as well. But she also facilitated an arts and meditation workshop for the foundation in 2023. But she led us through a beautiful guided mind body meditation practice so that she really gave us an experiential component. And then we had a really lovely discussion following that as well.
Yeah, she has a beautiful backstory. Just for those of you who maybe didn't see that session, Monica had a near-death experience. Gosh, I want to say over 10 years ago. And, she says it's so lovely. Like, she saw so much beauty and energy on the other side. It's like it's in a little backpack and she brought it back with her. And now she does healing for people in amazing ways. And, I had a friend, who said to me soon after Ben died, I think you should go see Monica. And I just didn't even hesitate. I said, sure, I'll go see her. So we drove to Richmond and the rest is history. But, she is a lovely spirit and really it devotes her life to this work. And so I was thrilled when she came on and she really, truly wanted this to be. And I kind of begged her and coerced her to talk a little bit about herself. And she really didn't want to. She wanted all of that time, to be given to her audience. Which was lovely. But Sheetal, walk us through, her. Uh,
Yeah, so she led us through a beautiful meditation and she did a number of different practices, you could say, kind of wrapped up in this one meditation experience, guided meditation experience. So definitely, I mean, we're doing a recap here, but definitely go back and tune into that and experience it for yourself. But she really leaned in and gave us an experience of a few different modalities, things like breath awareness, things like tapping into using sort of color and visualizations of light as well. So visualizations, color. She led us through a bit of a body scan. So taking our awareness and scanning different parts of our body to notice how it feels, to sort of cultivate that awareness and to release tension from different parts of our body as well that may be holding on to tension. And so she really, through that guided practice, led us through a number of different, you could say, kind of mini practices within that one larger experience. And then in our discussion afterwards, we really sort of pulled out some of those pieces as tangible tools that you could take even just one of those tools and start to practice it at home. And really the essence of all of that, which she shared after in our discussion afterwards, Wendy, and you had a few really beautiful reflections to this, but part of that was she was talking about kind of moving from our mind to our heart and that all of these practices really help us to do that. And you had a few really beautiful reflections from that as well, Wendy.
and, just in my career as a CPA, and I'm in the finance world, very analytical. And so when I started working with her, she would just repeat it. She was like, Wendy, you only need your analytical mind for work. And I was really kind of taken back by it. Like, what do you mean? Like, because, of course I need to plan for trips and do all the other things in your life. But over time, I really started to soften. And it really is true. I mean, you're always going to pull from your mind, but is really coming from a heart-centered space. And what I started to find is I started even at work, and maybe it's, cliche to say, but like this heart-centered space where my business started to change and evolve. And I was approaching the clients differently. The relationships are stronger at work. All of these other things just started to happen when I got out of my mind so much. I got to a point where I could hone in. Like if I had to review something or work on something, it was almost like I could feel myself going in do the thing, and then I'd come back out and operate from here. But sometimes it takes a situation or someone to point that out to us. And I do feel like collectively we are starting to approach things a little differently. So the people that I am talking to are around, it doesn't seem as, and I don't want to say serious because all the work we do is serious, but the approach is different.
Mm. Yeah.
Yeah.
I think I can imagine that initially hearing that can feel maybe a bit jarring because for most of us, honestly, for most of us in our day and age, just the way sort of life and our culture is set up, most of us do spend most of our waking hours in that analytical part of our brain, and we're kind of ruled by that analytical part of the brain, which there's nothing wrong with that. We need that as well, right? As you mentioned, there's times when we do need that. But the fact is, for the most part, many of us are spending very little time kind of leaning from this heart space or even connecting with that, even knowing and opening ourselves up, even just to ourselves, to connect with that, to practice connecting with that. So it really is a practice in those moments. And then, as you mentioned, your own experience of now being able to sort of hone in on that a bit more intentionally when you want to, when a certain thing that you're working on is calling for that as well. And, Wendy, I shared this with you a couple years ago. I set off on this path. It was when I had first left practicing clinical medicine, which I had practiced for over 16 years. And I was sort of carving out this new path that looked a little bit different for me in my own life, in my career. And I was not just my career, just how I was living my life in general. And, what I had said to myself is I'm going to allow myself to be guided by joy. And that was my mantra. And it was just, what is aligning with joy in my life? And that's the direction I'm going to go. And not all of that made analytical sense necessarily. But as you said, it opened me up to so many different things. And to relate this back to the caregiving experience as well, I'm just thinking, sometimes in that caregiving experience, your loved one might make decisions about their medical care or about different aspects of their life that might not make a whole lot of sense to you as the caregiver. But it's in those moments that sometimes you may need to sort of lead from your heart space. And again, respecting their autonomy, their sense of agency, and kind of like, well, how can I support them, through this as well? So there may be many situations and circumstances where this will be very useful within that caregiving context that can come up.
Yeah, and I think I shared this on the series with Capel that I became very clear as a patient on what I needed. I didn't put a lot of thought into it, but there was two people that um I knew I could count on at my appointments and help me through treatment that wouldn't bring their emotions with them. That's what I needed. I have a tendency to kind of want to be empathic, right? And so I'll feel bad if my caregiver is scared or fearful or whatever. And so what I was finding is that wasn't really working. So if the two people that generally accompany me, I know I can count on them. We talk before we go to the meeting about what we're going to say because of course, kind of what we leaned into in that series was, you only have 20 minutes. So let's make the most of the 20 minutes, right? And sometimes when you talk it out outside, you get some of that emotion out of the way and you can have like a much more neutral and effective conversation with that limited time you have with the physicians. Yeah. And they're not easy conversations to have. I mean, everyone is very well meaning. Like so many people wanted to go with me, but I was like, no, thank you. I'm good.
Yeah. Cindy brought that up as well. Cindy brought that up in terms of the caregiver experience and people maybe offering help. She herself has been in a caregiver role, she stated multiple times in her life, and people would offer help in different ways. And some of those offers for help actually ended up, of course, the person offering the help didn't realize that this is how it would be, but those ended up causing more stress or actually in the end making it more work for her without realizing it, right? And so just asking and one, asking, and then two, as the caregiver, the one who is that offer for help is being asked to, also just letting them know, like, thank you so much. I appreciate that offer. And Cindy did such a beautiful job of giving
Did.
examples of this. But, things like, thank you so much for that offer. At this time, that's not exactly what I need. But what would be really helpful right now is such and such. Right. And so I hope that, as we're talking, Wendy, kind of a couple of hopes that I'm getting from everything that we've shared over the past and that our guests have shared over the past 3 weeks, Cindy, Dr. Kapoor, Monica, that everyone who has tuned in, I hope that for patients, someone who's on the healing journey right now as a patient or as a caregiver, that they really feel empowered to really sort of tune in to what they need in that moment, to what their loved ones need in the moment, to have the courage to communicate that out loud, because it does take courage to communicate those things. But in the end, ultimately knowing that it is providing for and creating a sort of more nurturing experience for everyone involved through that. But really that everyone feels empowered to be that advocate for themselves, to tune into what they need.
Like Dr. Kapil explained, it's in the medical industry, it's just becoming less and less time they have with the patient. So it's really a necessity, to make the most out of your
Yeah, absolutely. Absolutely. So I'm curious. I think we had a few questions that were sent in. Um,
But one thing I wanted to mention, this came up after Monica's session on our debrief afterwards, that some people may feel if there was a transmission or a channeling that happened during that session, that it might not be as powerful on the replay. But I really, in my experience, listening to other podcasts and other meditations or channelings that I listen to, I feel them on the replay. And so we had this kind of interesting conversation that, the intent is for it to that information to come through, and that channeling for all the people who are going to listen, when we did it live and after. So now, kind of like past, present, future, it is there. So we encourage you to still do that, because we do feel strongly that it will be as effective.
Yeah, absolutely. And if you did miss any of those, they are all going to be available. We're going to release all of them on our YouTube channel in the upcoming days. And we will also be working on putting them on the caregiver resources section of our Peace Out portal, which is I guess you could call it like a sister site. I mean, it's what we've created, but it's a sort of a sister site, peaceoutportal.org. And then a question did come through the chat. So great question. What are some early signs of emotional burnout that caregivers often overlook? And how can we gently intervene before reaching that point? So goodness, what a great question. I can start to speak to that, Wendy. Some of the early signs of emotional burnout that caregivers or anyone really could experience, but caregiver burnout is something very real that can occur. And so it can resemble many signs of depression. Well, first of all, any type of burnout is characterized by exhaustion, so overwhelming exhaustion. That can be physical, mental, emotional exhaustion. It can be also related to a sense of detachment from sort of your day-to-day activities or responsibilities. It can be also, loss of interest or pleasure in things that you normally did enjoy doing. We see this often, and Wendy, I believe you and I had spoken a bit about this during when I was a guest on your podcast, Sundays with Wendy, and you did a caregiver, a season about caregiving, which is another wonderful resource for caregivers, that entire season. But we had talked about that as well, that sometimes we can lose our identity, right? There can be this sort of loss of identity because your whole identity can start to get wrapped up in that caregiving, because it can be such a sort of all-encompassing role and responsibility that you're playing, that you can almost feel this sort of loss of identity as well. So if you're detecting any of those things, how can you gently intervene before reaching that point? So through doing, I think, a lot of things that our speakers shared over the course of this series of, checking in. Both Cindy and Monica talked about this, about sort of checking in with yourself. And they both used a couple of different examples of sort of checking in. Cindy had used this example of kind of like when you wake up in the morning, um, kind of doing a quick tune in, like check in of sort of what percent, like if you're looking at kind of like a scale. So, what percent of, I believe the example she gave specifically is like, what percent of worried are you today?
Yeah.
And then, like, as the day goes on, if you woke up in the morning at like a 40%, and then as the day goes on, you're all of a sudden at like an 80%, well, maybe you picked up on someone else's energy. And so, kind of thinking back to like, okay, what can you do to get back to 40%? And then Monica gave another example of a way to kind of check in, and that was that she had mentioned sort of having a visualization of like a target, like a dartboard sort of target, bullseye target. And then sort of the middle is like your center, you're feeling whole and centered and calm and at peace. And then as the day goes on, sort of having these intermittently sort of checking in on sort of where you are on that target. And if you're slowly moving further and further away from that center, kind of thinking about, okay, what can I do to sort of come back to center? And then maybe it's some of these practices, right, that you then start to lean into. Maybe it's going for a walk, maybe it's doing a body scan, maybe it's tuning in with your breath. But those were, I think, really, both of them gave different examples of what sort of checking in with yourself can tangibly look like in your life.
And sometimes I don't think we give ourselves the permission to do it. I mean, if you're at your desk, you can shut your door for a few seconds. You can go into the restroom and just sit there. I feel like we can always squeeze some of these things in. As a caregiver, I tried to really incorporate or try to incorporate all the things that I did. And they weren't always going to a yoga class. I mean, sometimes it was like carrying my favorite yerba mate tea and throwing it in my purse. So I always had it with me because that was just something I did every day at 3 o'clock. And you know what? For the most part, I could still do it no matter where I was. I was in New York, I was wherever, and so it kind of keeps some sort of normalcy about your life. Throw your favorite book in your bag. I know with Cindy, she likes to crochet. And she always had that with her. So just staying true to yourself and the things that bring you joy that you can squeeze in.
Yeah, absolutely. And certain things, Wendy, you and I have talked about this before a bit too. I mean, both of us, we've had meditation in our own personal practices for quite a while. And so this is something that does take some sort of building up to and learning different practices and tools for meditation. But I just use this as an example that, we have both had conversations before that we could really meditate anywhere at this point, so there's some things that you can kind of take with you no matter where you go. Your breath is with you no matter where you go. You can always check in with your breath. What does that mean? It's like being aware of your breath, just noticing, okay, I'm breathing in now, I'm breathing out now, I'm breathing in now, I'm breathing out now. It can be as simple as that, but it's there with you all the time. Some people may take, and I don't think we really talked about this in any of the sessions, but you may have like some sort of a token object with you in the pocket. I know some people who keep like a certain sort of like a stone, and so they put their hand in their pocket and it helps them feel grounded, or a little, sort of fidget, something, that you just kind of keep with you. But it's just kind of gives you this sense of like, okay, I'm coming back to reminding myself that I can feel centered in this moment, and kind of having this sort of external visual or tactile cue.
Just a mantra, a simple little mantra. I mean, mine have changed so much over the years. I mean, I think I used to casually say, "Oh, it'll be fine. It'll be fine." And then I realized how kind of passive that actually was. Of course now they're different, but that can be grounding as well.
Absolutely. I've used mantras or phrases or affirmations so much in my life as well. I still do to this day. And it has varied over the years in terms of what, sort of I've used so many. So some have stayed pretty steady that I like keep going back to. And then some are new in terms of, for a specific situation. But that can be really helpful because our mind likes to attach to words. And so it can easily attach to words and thoughts, and it can kind of go on these spirals. But if you, in through these affirmations or mantras, you are intentionally giving your mind words to attach to that you want your mind to attach to, like, I am safe, I am calm, right? That sort of thing.
Yeah. Sometimes if I see it good, I will take a ton of them, like snapshots on my phone that roll through my social media. One I kind of go back to every once in a while is I let everyone hold whatever frequency they choose. And I found that that really helps me not react in a situation or have to be entangled or more more in a situation than I need to be because it's fine. Like we're,
And that's a
so
great one for, going back to that like empathic conversation.
mhm.
That's a great one because that's saying, okay, you're at your frequency. I'll let you continue to, move at your frequency and I'm over here in mine and it's all gonna be okay. So yeah.
Yeah, so sometimes I find some good ones. Yeah, I've got a little library now. Yeah, but I have found over the years, and it is definitely, I think, started with Monica, gosh, over 8 or 9 years ago, but it's really how she really taught me to meditate in a really meaningful way. I think we can all close our eyes, but she really guided me to something, and I've, sought out, oh gosh, all kinds of healing modalities between Reiki and reverendship and, oh gosh, the healing cure. I mean, all these different things, and all of them have brought like a layer. So, I just love learning. And so now what started as like a simple meditation and a body scan just builds in layers all the time. Now I'm up in a Stargate, which is really kind of fun and cool too, but it's very rare I don't meditate in the morning. And it is not long. I mean, you don't have to sit in the lotus position, your hands up, and
And it doesn't have to be long. You don't have to do it for like half an hour, even just a couple minutes is helpful. And, for anyone who's listening who is like, I think I want to try to learn some meditation techniques, a few resources. So Monica's video from session number 3 of this series. We also have a couple of guided meditations, actually a few guided meditations on the Peace Out portal. One of them that I actually facilitated as well, but we have a few there on the Peace Out portal, and that's free, accessible. Just log on to peaceoutportal.org and you will find those, I believe, under the Mind Body tab, and you can just tune in. And all of those are less than 10 minutes. They're about 5 minutes long. So, just kind of a way to get started with that. Now, there's another question that came up in the chat, and I'm going to read this, Wendy, and I am thinking of a couple of specific examples that you have shared with me and that you've shared publicly in different forums, like on your podcast, on my podcast when you were a guest on mine, that I think would really speak to this question. So it was, many caregivers struggle with burnout, but often feel guilty for taking time for themselves. How can we reframe self-care as a necessary part of caregiving and how to deal with the guilt?
gosh, I was just thinking about that recently, and I've shared the story, but I feel like it's worth sharing again here. But we were in New York. Gosh, we were there for about 4 weeks, and Ben was in the hospital in isolation, and I hadn't even done yoga before ever, and I mean, it taught leaning into myself, feeling like I really need to stretch, like I really need to move my body. So I just Googled the yoga studio near me, and I just walked 3 blocks, but I was riddled with guilt. I was like, what kind of mother leaves their child in a hospital? I mean, he had his father there. He wasn't by himself. But by the time I went and did the yoga and I walked back out on the street, I felt like a completely different person. And then I never felt guilty again, ever. Like I got into an argument with his father one time. I forget what it was, but I said, we can't just sit here and stare at him. He's sleeping. Like, why do we both have to be in the room? I can't remember what was going on, but that wasn't effective either. I mean, the room was like, it's so teeny. It was so ridiculous for both of us to be in there. But there's so many things that are just like you look around and you're like, oh yeah, I mean, you could walk around the block.
Yeah.
And
Yeah.
Ben, I think I've shared this too. He was newly diagnosed and he looked at me and he said, Mom, why aren't you going to ballet anymore? Like what's your problem? And I didn't want to make him feel like the situation was any more serious. And I just kind of like, you said something, oh, we're really busy or whatever. But I was like, he needs the normalcy. Like your life doesn't have to come to a screeching halt for you to be able to show up and care for somebody 100%. And I truly feel that way. And I say this too, that our life kind of expanded in so many ways during that time he was sick. So I know there's a way to do it. There's a
Yeah.
way to do it that is fulfilling to everyone involved and that really carries life forward. And you can live fully and still be in a not so great situation, right? So
Yeah.
sometimes I think it's the mindset around it as well.
Yeah, those are such beautiful examples, and yeah, those are the examples exactly that I was thinking of that I've heard you share that I thought would be just so an important way to address this
Right.
question. And I think a few takeaways I have from that is one is, yeah, you probably will feel guilty the first time that you do it. And that doesn't necessarily mean you don't do it though. But like, but yeah, you probably will feel guilty. And maybe the whole time you're doing this thing for yourself, you'll feel guilty. But then it's like you realize, and what you realized is like, well, this is helping me show up better for Ben or feel whole or feel different, right? And so I think through that, through experiencing that and noticing the difference yourself, that kind of leads you to the next step of continuing to tune in and check in with yourself and sort of find ways to build some of this in, even in the midst of very tumultuous or challenging or demanding times. And then the other part that sort of a takeaway that really stuck out to me that I believe Cindy also mentioned too, and you just mentioned of kind of like your loved one wants that sense of normalcy to some degree for you too. And you had mentioned this also earlier that like, as an individual going through the healing journey as a patient, right? There can be all these feelings also of like, oh goodness, this person took out time in their schedule to have this appointment with me, things like that. And so seeing like they also want to see you still having some sense of normalcy, right? And I think that helps them as well to some degree and take some, perhaps if they are also someone who is very empathic, they may feel some of that burden and carrying that weight too of what you are experiencing as the caregiver. Like it can go both ways, that sort of feeling of like that heaviness or what may come with that. And so it kind of helps sort of restore and take some of that load off as well for everyone involved. And what you said, like Ben was just so used to seeing you go to ballet. And so it was like, well, why is this different? Right. And then I think Cindy's example was with her crocheting, right? That it also gives her something different to talk about because with her and her loved one, like she realizes like, well, maybe they don't want to be talking about their diagnosis and their health like
Talk about that all the
24/7.
time.
So she gets to talk to them about her crochet projects and things like that.
Mhm.
It also it does restore that sense of normalcy, even when the situation can feel far from quote unquote your normal day to day.
Yeah, very much so. I know there were several times I went for a run up at the hospital and, I think Ben was like, "Whew, good, she's going for the run." We had that banter naturally, but it just kind of just really came through, when things got intense. Yeah, I say all day long, do what you can within reason to really like you say, fill your cup. I
Yeah.
can't imagine if I hadn't kept up some of those practices during that time.
Yeah.
Yeah. I wonder if there's have you checked, is there any more questions coming through in the chat?
I don't see any more right now. So if anything else comes in the next minute or two, we can address it. But otherwise, I think some of my sort of takeaways that I hope people tuning in are getting, I mentioned it earlier, but again, is to really feel empowered to be an advocate for yourself, for your loved ones, to tune in regularly with yourselves and with your loved ones to communicate your needs with each other. And if you missed any of the sessions in this series, definitely go check them out. And then I also wanted to mention that the Peace Out portal, again, is a great resource. We have many guided activities, guided resources, all less than 10 minutes long, so that we really designed that to intentionally be something that you could do while you are in a waiting room or, receiving a treatment or something like that, because we wanted them to be accessible. And also when you may not have a lot of time, that you could still do that. So that could be a great way to get started.
Yes, and please keep in touch with us. Like and share our post on social media. If you have any feedback, feel free to send it our way so we can continue to provide the best content for you and our audience. So thank you for joining us. If you're watching this on the replay, if you can leave us a message or a thumbs up, we would love it. And we will see you soon.